Good morning, little nerds. I'm Dr. Shereene Idriss, and welcome to my YouTube channel. I'm a cosmetic derm, and we do a deep dive every Saturday into the world of skincare, cosmetic procedures, medical conditions, product roundups, ingredient stories, you name it, we cover it. And if you do not follow along yet, I don't know what you're doing because you clearly do not know what is good for your life. So feel free to subscribe and follow along and leave a comment on whatever it is you want to learn about more or what you're curious about. What the hell are we talking about today? Today, we are doing a deep dive into the Arnica story, because Arnica is one of those ingredients that have been around for years and years and years, and we've kind of gotten used to it. Maybe not so much in the US, but definitely in Europe. People are much more used to using and having Arnica in their daily pharmacy cabinet at home. It is an age-old homeopathic remedy, but it doesn't mean that Arnica itself is a homeopathic ingredient, and we will touch on that in a second. But it also is known as Arnica montana, and it comes from a perennial yellow flower, also known as the daisy family. And as you see on a lot of the packaging, they will have daisies. They're not there by coincidence. They're there because of the root of the actual ingredient, no pun intended. And its earliest uses on record are around the 1500s, where in America, indigenous populations used to take and prepare a tea from the roots of the Arnica plant to help with back pains. Now, in Germany and in Russia, there's also some documentation of the use of Arnica that was used to treat wounds, black eyes. I don't know why they specified black eyes. I guess people were punching each other a lot back then. Sprains and bruises. But the herb itself can also be taken orally. And back then they used to use it for hemorrhagic uterine issues, like during pregnancy if you were bleeding out, or even if you had cardiac issues. So typically nowadays you'll find it in the form of a gel and a topical formulation. You can still find Arnica pellets all over the place, so it can be taken orally. And it is one of those treatments that procedural physicians, whether they are cosmetic dermatologists or Mohs surgeons or plastic surgeons or surgeons in general, or even other procedural providers, oftentimes recommend Arnica to their patients post a procedure to help minimize the look of inflammation and swelling and bruising. So it's something that has been used anecdotally for years. The main benefits are fourfold. Number one, it helps to soothe inflammation. 2, it helps to reduce the look of swelling. 3, it helps to reduce the appearance of a bruise. And 4, it helps with stiffness and muscle pain. How exactly does it do this? Arnica is made up of 3 main active components: sesquiterpene lactones, flavonoids, and volatile oils. Now, the sesquiterpene lactones are very bioactive, with a wide range of bioactivity ranging from anti-inflammatory effects. How does it have anti-inflammatory effects? It blocks the release of cytokines, which are oftentimes released in an area of trauma. Whenever you have an injury, macrophages come in, trauma happens, macrophages releases cytokines, more inflammatory cells come in. Arnica blocks that signal to get more inflammatory cells to come in. It also has analgesic effects, which can help with the muscle stiffness and the feeling of pain. In addition, the flavonoids are great antioxidants that helps reduce the swelling and the look of swelling. Plus, Arnica is also believed to increase the circulation of blood flow. So less blood and fluid is going to remain stagnant in an area, and you're going to have less fluid and swelling, and the look of bruising is going to be minimized in that area. That is why some people recommend Arnica for the under eyes if your dark circles underneath your eyes are due to vasodilation from just being congested due to allergies, etc. So let's talk about homeopathy and Arnica. When you say homeopathic, and I actually have to credit my YouTube community for this because I think I made a mistake once in saying that an ingredient was homeopathic. That is not the case. Arnica itself is not homeopathic. That doesn't make sense. Homeopathy is a therapeutic method that uses natural substances like Arnica to relieve symptoms, but it's the actual method in which the products are prepared that makes it homeopathic. In fact, the active concentration of these ingredients in homeopathic products are significantly lower than the percent claimed, as these actives are diluted. Here you can see a bunch of different examples, but when you see 30x, 7x, 3x. That means it is 3 times diluted, 7 times diluted. And it's a little bit misleading if you do not have that understanding, because to the layperson, you might think it's 30 times stronger, but it's quite the opposite, because that has to do with how homeopathy practices. They believe that a little tiny bit of an active can trigger your body into remembering how to heal itself. And it's not so much about the ingredient itself. It's a whole discussion for another day, but that is what the X's mean. Additionally, there are no FDA approved products labeled as homeopathic. So even though you may find a homeopathic with a drug fact label, a homeopathic product with a drug fact label on it, this is not FDA approved at all, and it is being marketed in the US without FDA evaluation for safety or effectiveness. I'm just saying that so that it is very clear that this ingredient is not always prepared in a homeopathic fashion, but oftentimes homeopathic remedies include this ingredient. So Arnica and the credibility of it has been one that a lot of physicians and experts, including myself, have recommended to patients over the years. In various different news outlets, you will see that it has been quoted as providers' go-to. From well and good, can Arnica really help treat dark circles? A dermatologist says yes, and it was not me who said this, but this person wrote, I encourage all of my patients to incorporate topical Arnica into their post-treatment regimen to reduce swelling and bruising. Another person said in style, how to get rid of a hickey ASAP. Applying topical Arnica gel several times a day will help break down the bruise and turn it from purple to yellow faster. And additionally, the proposed mechanism of action is to increase circulation, which allows the body to clear away the bruise quicker. Additionally, tired, puffy eyes are no match for these expert-approved eye creams, in which there are some creams that include Arnica that can help with the look of puffiness as well. So it's something that has been around for years, which leads me to a small little product roundup. Let us jump in. So if we have to think of Arnica, we think of puffiness, we think of the look of bruising, we think of the look of congestion, especially around allergy season, and we can even use it for other parts of our body that are extremely sore. If you're getting a cosmetic procedure, fillers on your face, it can help. Even if you don't have swelling or bruising, it can help with the soreness associated with it. If you are an athlete and you work out, you can use Arnica on your body to help release the tightness, the soreness, and give you the relief that you're looking for. So starting with one of the most famous brands on the market that are a homeopathic brand. Again, not that Arnica is a homeopathic ingredient, but it is included in this homeopathic remedy, is Arnicare by Boiron. This is probably the leading brand when it comes to homeopathic remedies. Again, just because it has a drug fact label does not mean that it's FDA approved. This is a gel. It retails for $10. I usually recommend this particular product, and this is a brand new one, for people who have had any sort of stiffness, muscle ache, etc., because a little bit goes a long way. It's not necessarily the most elegant formulation, but a little bit does go a long way, and I don't have Kleenex again when it comes to the Arnicare gel from Boiron. Okay, I'm gonna wipe it on my white coat. Number 2, this is actually a product from Spain that a lot of Spaniards are very familiar with, and I actually really like this one. This is Arnidol Gel Stick. It actually comes in the form of a stick, and this one retails for approximately $15, and it's really nice. You know when people have a lot of windburns on their lips and their lips are swollen and painful, this is where the Arnidol gel stick comes in handy. And this particular one is actually made for kids and marketed for kids to help soothe bumps and bruises as your little ones start walking around and bumping into things. So this is Arnidol, and it is a staple in a lot of my Spanish friends' closets. Moving on from that, we have the lady of the hour, the one that I created, the Deep Puffer by Pillow Talk Derm. Full transparency, this is my brand if you are new here, so I don't want you to be misled in any way, shape, or form. I decided to create an Arnica-based powerhouse serum with other actives to really help reduce not only the look of swelling and puffiness, but also the look of redness. Because when you have swelling, when you have inflammation, reducing the redness component can make a huge difference. And I've combined it into a roller because people love to roll, and rolling has benefits in terms of lymphatic drainage. So I thought to myself, why not bring the roller into the 21st century by combining it with actives that actively do what the roller does once you're done rolling. The beauty of this product, and I'm going to just take a second to show you here, is that you can turn it on and off in order to get the product out, and you can even take the cap off to clean the cap because you do not want any goop accumulating in here. Plus, if you just want to use it as a serum alone, you can literally just squeeze some serum out. It is multi-use. I like it for the face. I use it twice a day as I do any serum in my routine. And if I have any cuts or hits or bumps on my body, I've rolled this on my body several times. It retails for $38. It is a combination of Arnica with Centella asiatica, and that is why it has that burnt yellow hue. Niacinamide, ash bark extract, Agastache mexicana flower complex, as well as a few other goodies. But it is a tried and true, clinically proven product because we did clinical studies on this one. So it is not based on hearsay, that it is clinically proven to reduce the look of swelling and reduce the look of redness when used twice a day for 4 weeks. Love it because I made it. And then you have First Aid Beauty, which has their Fab Arnica Relief and Rescue Mask. Now this is a face mask. I like the packaging. I'll show you guys. It comes in a tube and you just have to apply it on your face. If you're into face masks, you're gonna be into this one. This is a light blue hue, as you can see over here. And then you put it on your face and you wash it off. It has calendula, it has arnica, it has shea butter to help protect the skin barrier. They say to leave it on for 15 minutes and then to massage any remaining product into the skin or to wipe it off with a tissue. It does have shea butter, so if you're acne prone, just be a little bit careful with that one. Other complete side note, an interesting side note, is that arnica is often used as a perfuming agent as well. So Pillow Talk Derm, the depuffer, is fragrance free. There is no added scent. There is no masking scent, and that is why it is not unscented. It is just fragrance free, but there is a scent, and the scent that you will smell is very much a herbal scent, and it is the scent of arnica. And other brands actually use arnica to scent their products, like, believe it or not, Good Genes by Sunday Riley. They actually have arnica as a perfuming ingredient, and so does Summer Friday's Dream Oasis. And with that, you guys are much better educated when it comes to arnica. As always, arnica, like any ingredient, can be irritating, so patch test first. Do not jump in with face first all the way right away. Always patch test first, especially if you are sensitive. And if you are pregnant, check with your OBGYN. I would avoid any oral form of arnica. If you have any cuts, nicks, or bruises, you can use it in moderation, but I would always check with your OBGYN as to whether or not you can use a topical formulation of arnica. And with that, I wish you guys a beautiful Saturday, and I will see you guys here next week. Let me know what you want to learn about more in the comment section.